can mean the difference between life and death. You're responsible for people's lives and your own. Slow down and save lives.
You're with James Freeman and the Freeman Report on today's News Talk Radio, TNT.
Right, now we've had both candidates in the race to lead UKIP over the past couple of weeks, Bill Etheridge and Lois Perry. We've also had the chairman of UKIP on the show here. So I'm delighted now that we've got their new spokesperson for health and social care. His name is Dr. Chris Ho. Hello, Chris. Welcome to the Freeman Report.
Good afternoon, James. Thanks for having me on.
Yeah, thank you for joining me. We're going to talk all about the NHS. I've got lots of questions for you. I guess, first of all, if you had to describe the NHS to somebody who wasn't familiar with it, how would you describe the current state of our National Health Service?
I can only describe it from my own experience and what I know about the NHS. I'm in Scotland, so the situation here is slightly different because the Scottish Health Service is under the remit of the devolved government here in Scotland. But my take on the NHS is that knowing what I know, it is an unsustainable, failing service that is going to take a lot of effort to change the way healthcare provision is provided to make it more sustainable.
Do you think we can save the NHS, though? I don't think the NHS is what most people in the UK think it is, whether you're in Scotland, Wales, or in England. I think a lot of people still, I think that's changing rapidly, but I think a lot of people have still got that it's universal healthcare. And if you get anything wrong with you, you can just pop off to the hospital and it'll get fixed. That's not the case anymore, is it? I mean, do you think we just need to start again and figure out what we actually want as a healthcare service in the UK?
I don't think we necessarily have to start from scratch. But I think certainly the NHS has grown beyond any reasonable means of maintaining a reasonable level of quality. So yes, we should ask ourselves, what do we want from the NHS? Any health service, to quote Ben Shapiro, can only achieve 2 out of 3 things. The 3 things being quality, affordability, and universality. So if we want to keep the quality good and it to be affordable, unfortunately, it cannot be universal without the negative consequence of that being greater government spending, more borrowing, more printing of money, and inflation. All right, so yes, if the general public, if that's what they want, then that's the path that we're on at the moment, as we can see. But I think that there's a wide swath of people out there who are increasingly observing that the quality that the NHS purports and wants to provide is lacking. And this can range from anywhere from long waiting times at even the emergency services, much less the elective outpatient clinics, surgeries, and even some treatments are no longer on the table when it comes to the NHS. So unfortunately, the idea of a universal health service that does everything for you from cradle to grave is simply unsustainable. Or if we're happy to keep paying for it with inflation, then that's not the ideal path the way I see it, and the party.
Do you really think that's the case, though? Because we've got. I'm looking at some numbers from England, and I take it you're in Scotland, but look, I've got some numbers for here from England. The number of nurses is up 25% since 2010. The number of doctors is up 45% since 2010. And yet we're still seeing no improvement. I'm wondering if actually the money, we all hear about the bureaucracy of the NHS, the fact that we've got these middle managers that are being paid absolute fortune. We've obviously got the private aspect, the privatized aspect of the NHS now. Do you not think that actually the problem that we've got here is there's loads of money going in, there's plenty of money, but it's going to the wrong places. It's being spent on the wrong things.
You are absolutely right, James. I believe it's on the BBC website when it come up, where they've published the NHS funding over the last 10 or 15 years. And despite the period of austerity that the Conservatives wanted to bring in, NHS funding has only ever increased. Whether it's increased in pace with demand, though, is the important question. And of course, when it comes to demand, population growth is what's driving it. All right. So you can have welfare and universal health care, but you cannot have open borders along with it. You can have both. You can have one or the other, but not both. Because what happens then is when you have a net migration, I believe the figure is about 700,000 for the last year, 600,000. When you have a net population growth of 600,000, it's going to take a lot of money to keep up with the demand. And we're seeing that with housing and other services as well. So, and I would agree that despite increase in numbers of frontline staff, we're also seeing an increase in the numbers in management staff and other related staff members. Don't get me started on the whole diversity initiative as part of it as well, which I'm not sure they it's not easy to quantify the benefit that they bring to any public service.
Yeah, exactly. And then there's 100 million. We've just found out that the NHS has spent on interpretation services in the UK, which is an English language speaking country. And yet we're spending 100 million. That could fund 3,000 nurses. It's clear that there's a lot of money being directed to things which, and like you rightly said, all of this diversity and inclusion nonsense, it's got no place if it's taking up money away from frontline services. Chris, what is you're the spokesperson for UKIP. I take on board that I think you're the new spokesperson. But what are UKIP's policies on the NHS? What does UKIP propose doing to sort the problem out?
Okay. Yes, I've only been the spokesman for UKIP for about 3 months, I believe.
Okay.
And we've also had a new manifesto released with some minor changes. I think broadly speaking, we want to keep the NHS, but reform it, of course, in terms of how we go about meeting staff requirements. I think the priority for UKIP would be to train more local staff rather than import staff from overseas. We also want to direct funding more appropriately, as you mentioned, away from areas whereby it's questionable the amount of good it brings to actual healthcare provision. We also want to look not just appropriate funding for the NHS, but let me think. You put me off guard there with that question. Yeah, I think that's primarily the main areas that I can recall at the moment from the manifesto.
Yeah. And Chris, you wrote an article recently, didn't you, or a short piece on a problem actually we've got with the recruitment within the NHS, and this is all about the nurses, the Nigerian nurses. Tell us about what you've written about.
Okay, well, I on my daily news updates, I caught wind of this piece of news, and primarily I went to the article published on the Guardian website, which was a bit surprising considering the news. It reported that a number of nurses who were either already on the nursing register or were being considered to be entered into the nursing register from Nigeria, and specifically one test center in Nigeria were found to have their qualifications. Well, they were being questioned. I believe a number of them have already been removed from the nursing register, and there's an ongoing investigation into this. It was also published that despite, along with this single test center in Nigeria, a number of other test centers around the world have also been scrutinized about this. So it may be more, the problem may be more widespread than we initially see.
But this is an industrial scale qualifications fraud, isn't it? I think there's seven. Am I right in saying there's 700 Nigerian nurses? And of course, as you quite rightly said there, they're now, this is just what they found with these certain test centers in recruitment centers in Nigeria. How likely it is, because I mean, this is a much more widespread situation, because of course the NHS has been looking to plug the gap in UK recruitment from overseas. We've taken in lots and lots of doctors and nurses in the last decade from those countries. Do you think the rush to do that means that we're actually getting a lower quality workforce?
Oh, I think this situation is unsurprising, considering the rush at which we've or the lengths we've gone to recruit from overseas. I mean, this situation raises all sorts of questions, not just about healthcare provision, lowering of standards, competency of regulation of foreign workers, immigration law, potential harm as a result of that. None of this was mentioned in the article. So yes, I think if this issue is allowed to run and being properly investigated in the public eye, then who knows how far the rabbit hole goes with this.
Yeah, and in terms of UKIP's solution, obviously that is training more UK nurses here so that we don't need to go abroad. Obviously, at face value, that sounds like a brilliant idea. If we started that today, how many years would it take to actually solve the problem? Because of course you can't just, click your fingers and get qualified nurses. How long would it take before we actually started to see an improvement?
Well, if we're talking nurses, then it would take them 3 to 4 years to do their nursing qualifications. Some of those years would involve having placements. So actually being a student nurse or an assistant, a healthcare assistant in the primary or secondary care. And then once they've received their full registration on fulfilling their training requirements, we're talking 4 years, I would say, to train a fully qualified nurse, which, at least we would know that they are legitimately qualified, as opposed to a potential nurse from overseas. So there's no short-term solution when it comes to wanting to maintain our standards of having appropriately and competently trained staff to operate on the front lines.
Yeah, so I think you're saying, because obviously, it's not just about doing the degree and then you're a qualified nurse. It takes a while of training as well, actually, on the job. So I think what you're saying is, if I read between the lines, around a decade, really, if we invested heavily in getting lots of new entrants in the UK, then we'd be looking about a decade. Chris, very, very quickly, you've got about 30 seconds. Why do you think the UK government isn't doing that?
There's probably a few reasons for that. One is short-term perspective, so they're not considering long-term implications when putting into place their policies. I think primarily that's the case. Then,
I'm going to have to stop you there, Chris. Sorry, that was probably unfair of me asking you that question with only 30 seconds. But listen, Dr. Chris Ho, everybody, UKIP's official spokesperson for the Health and Social Care. Thank you very much for coming on the Freeman Report. Thank you.
Thanks for having me.
We're going to take a short break now, but don't go anywhere.